Give Kids a Smile Day is a nationwide event. It actually began in 2002 by a group of very enthusiastic, community-oriented dentists in St. Louis, Missouri, where Elizabeth is from. And then soon, American Dental Association, the ADA, noticed the importance and the significance of it, and so it became a widespread nationwide event, which takes place every February. And thousands of dentists across the nation volunteer their time to just provide free dental care, including exams, preventive care to children in the local area.
And I think we encourage all children to come to our event. It's open to anyone ages 4 to 17, but I think we're particularly targeting kids without insurance, kids who don't already have an established link with a dentist currently.
For Give Kids a Smile at UCSF, the school does provide the clinic, the second floor clinic, to be open for that whole day, where it's not readily available for other community services activities that we do off-site. So here we have all the equipment we're used to, and the school is donating a lot of the supplies to just make this all possible. We actually also get a lot of donations from other companies, and we've been able to put this thing together. So, and a lot of faculty members also to donate there.
I think it's much larger scale than most of the events that we usually go to, where we just do screenings, because we have faculty volunteers and student volunteers from all 4 classes. And we also are a lot less limited in what we can do, because when we go to a screening, it's, we can kind of put gloves on and look in someone's mouth, but here we have the opportunity to do a lot of, not a lot of restorative work, but preventive care.
That's more hands-on and effective.
And we also, often when we go to community centers and have health fairs, we bring an education component, and at Give Kids a Smile Day, we'll also have that. We have a whole room dedicated to education, hands-on games, and that sort of stuff. So. A big part of preventive care is education, and just having the kids come in, having them be screened, having dental students be able to talk to them about brushing regularly, flossing regularly, using fluoride toothpaste, watching dietary habits that can cause tooth decay is really important. And then we actually do
a lot of we can do place sealants if we think that would be beneficial. A lot of studies have shown that sealants are very effective in preventing future decays in deep fissures. And we also do fluoride varnish application to just really strengthen the teeth. And we also do examination to just make the kids, as well as the parents, aware of the oral health in their children. And we provide basic cleaning.
And then we send everyone home with a bag that has toothbrush, floss, toothpaste to sort of reinforce what they learned during the day. And hopefully they'll keep up with their hygiene.
Last year we saw 192, I believe, children, and this year we're shooting to go over the 200. So we're preparing ourselves for about 250 children, but hopefully, yeah. I personally remember this little boy I saw. He was really afraid of just being in the chair, and so we pretended that the chair is kind of like a spaceship as it moves up and down, and he got a little excited, and we have these protection goggles, and we're like, let's put this special goggle on, and he got really excited about that as well. So I think it really helps to for children, especially if they've never really seen a dentist before, to come and know that going to a dentist is not a scary thing. And when we actually did sealants on him, we had to remove a little bit of the calcified tooth structure, so we have to use the handpiece, which I think is very frightening for children, making that high-pitched noise. But I just showed it to him how it works, and I just said it's just going to spray a little bit of water, and it's not going to hurt. And at the end, when we were done, he just smiled. He was like, it wasn't painful at all, it was fun, and so that just made my day.
Yeah, I think there's a big range in terms of the kids that come in and how much experience they've had with dentists. Some of them have never had anything put in their mouth before, and it is a really frightening experience. But we try to have, we always have this balloon guy that comes in and makes these really elaborate balloon decorations to give to the kids. And then they have, in the education room, it's sort of like a treasure map where they can follow different booths around and get stuff stamped, and they go away with a goodie bag with some prizes in it. So we try to make it combine like the dental visit with something fun. Vietnamese, Chinese, Japanese, Korean. Yeah. I mean, that's one of the really, our student body is really diverse, so we're able to accommodate patients who don't speak English as their first language. So
we speak your language.
Yeah. Yeah, that's pretty cool.
Good.
It's really exciting for us as a public institution to have the opportunity to reach out to our local community and provide them with this kind of service.